Okay, so this is part 1 EKG interpretation. We're going to be talking about rate, rhythm, and QRS axis. Starting with the rate, if it's a regular rhythm, you can use to calculate the rate the counting method 300 divided by the number of large boxes between R waves. And this is only if it's a regular rhythm you can use this method. If it's an irregular rhythm, something like atrial fibrillation, you can count the number of R waves on a 10-second strip and multiply that number by 6. So that'll give you the total number of R waves in 60 seconds. Normally 60 to 100, bradycardia less than 60, tachycardia greater than 100. Next, we're looking at the rhythm, regular versus irregular, sinus versus non-sinus. In sinus rhythm, you have a P wave before every QRS and a QRS after every P. Usually there's a regular rate 60 to 100, and we have upright P waves in lead 1, 2, AVF, and V5, V6. P wave is best visualized in lead 2 and V1, so if you're looking to see if it's sinus or non-sinus, these are the best leads to look at. Incident differentials with atrial rates, 100 to 180, you usually see sinus tachycardia, 140 to 220, we see atrial tachycardia, AVNRT or AVRT, and 260 to 320, this is our atrial flutter. P wave axis usually upright in lead 2 and biphasic in V1, and that's normal. Next, AV block, first degree AV block, usually PR is greater than 200 millisecond. Second degree Mobitz type 1 compared to Mobitz type 2. So Mobitz type 1, the Wenckebach has a progressively lengthening PR interval until a QRS is dropped. And Mobitz type 2 has just a sudden QRS dropping without preceding PR lengthening. So that's the difference between those two. Third degree AV block is a P and QRS complete dissociation. So next we're going to be talking about QRS axis, normal axis between negative 30 and 90 degrees. This can be seen in predominantly positive R in lead 1 and lead 2. So this is a positive deflection in lead 1 and lead 2, and this is normal, so between negative 30 and 90 degrees. Left axis deviation, this is between negative 30 and negative 90. We have positive in lead 1 and negative in lead 2. And differentials here include left ventricular hypertrophy, left bundle branch block, hyperkalemia, and inferior MI. If you see a right axis deviation, this is going to be a negative in lead 1, positive in lead 2. Differentials here on the right axis deviation include right ventricular hypertrophy, dextrocardia, Wolff-Parkinson-White, and lateral MI.